Hello and welcome to Part 4 of Ontario Regulation 29910 training video. In this section, our focus is on the quality assurance measures that concern service agencies that own or operate residential services and supports that are identified as supported group living residences and intensive support residences. Supported group living residences is a staff-supported home where 3 or more adults with a developmental disability live and get services and supports from an agency. Intensive support residences is a staff-supported home where 1 or 2 adults with a developmental disability live and get full-time services and supports from an agency. Service agencies must promote the well-being of people with a developmental disability who live in these residential settings. The person with a developmental disability must receive the information and support that they need to live as independently and safely as possible. Service agencies will ensure that assistance is provided to the person to attend regular medical and dental appointments as needed. A log or documentation will be kept on file with respect to the person's regular medical and dental appointments. This could include annual medical forms, healthcare provider forms, medical appointment summary forms, and healthcare treatment records. Service agencies will ensure that a separate medication administration record is kept for each person. A medication administration record could be created by the agency or printed by the pharmacy. It is necessary that consent, as applicable, and information is provided to persons with developmental disabilities with respect to prescription medication, such as information found in the CPS, Compendium of Pharmaceuticals, and Specialties Guide, or from medication information sheet provided by the pharmacy. Consents must be obtained, and the periodic review is required for the administration of psychotropic prescription medications. Diet and nutrition, such as informational materials from doctors, nutritionists, dietitians, or other health practitioners. Personal hygiene, personal fitness, and sexual health, such as informational materials from doctors, nurses, pharmacists, or other health professionals from public health units, libraries or bookstores that have been shared with the person, sexual abuse awareness and prevention courses. Behavior that may pose a threat to the person's health, safety, or well-being, such as informational materials from health professionals or from public health units that have been shared with the person. This may include information on topics such as smoking, alcohol consumption, and/or drug abuse, gambling, addictions, and community support resources. Self-esteem and well-being information or education that promotes self-esteem and/or personal well-being. This may include participation in self-advocacy groups, places of worship, a religious or a spiritual organization, a social group, parks and local events, and/or fitness or special interest classes that might be appropriate for the person and his or her interests. Communication skills, such as use of visual communication aids or photos and pictures, environmental modifications for visual and hearing impairments, sign language and literacy classes. Developing relationships, such as local information through pamphlets or internet websites about clubs, activities, social events, volunteering opportunities, self-advocacy groups, and mentoring programs. The information provided will be made as applicable and appropriate to the persons with developmental disabilities. Service agencies will have policies and procedures on food and nutrition that are consistent with Canada's Food Guide and also recognize the diversity, culture, and choices of the person with developmental disabilities receiving supports. It is necessary to have policies and procedures regarding the inventory, care, and maintenance of the personal property owned by each person with a developmental disability. Compliance with the regulation could include inventory lists, photographs of personal items maintained in person's binder or file. Service agencies will have policies and procedures regarding pets and service animals in the residence. Service agencies could keep copies of immunization records of pets and service animals. It is necessary to have policies and procedures regarding scalding prevention. The service agency will have a method of temperature control, monitoring, and documentation to ensure that in each residence, the water from a faucet is not hotter than 49 degrees Celsius. This could be a water tempering device installed on the hot water heater. Service agencies could incorporate the monitoring and documentation of temperature control in shift and duty checklists. Service agencies will have policies and procedures regarding supervision during bathing and showering to ensure the safety of the person, as appropriate to the needs of the person with a developmental disability. The individual support plan should identify the level of support they require. A notation could be kept in the individual documentation that indicates the support is provided. To ensure that the residence is a safe place to live and has the comforts of home, service agencies will ensure that all areas of the residences are kept safe and clean. A form has been included on the web portal in order for you to assess the safe and clean conditions in each residence. Service agencies will ensure that the residence has a recreation area or common area. These areas, both inside and outside the residence, will also be kept clean and safely maintained. Service agencies will ensure all exits in the residence are kept clear at all times. Compliance will be indicated through documentation on forms such as daily or weekly health and safety checklists, workplace inspection checklists. Service agencies will ensure that appliances and furnishings in the residence are clean and are in good condition and working order. Service agencies will ensure that hazardous household products are stored and used safely. Service agencies will ensure that the temperature in the residence is not lower than 20 degrees Celsius throughout October 1st to May 31st each year. To ensure the personal dignity of the person receiving supports and services is respected, service agencies will ensure that sleeping accommodations for each person will have a bed of appropriate size, a suitable mattress, bedding appropriate to weather, appropriate individual furniture and clothing storage in the bedroom where possible, sufficient space to keep their personal possessions and to pursue hobbies and interests without unwanted or unwarranted intrusion from others, an exterior window and window coverings. To safeguard the health and comfort of persons receiving supports and services, it is necessary that the service agencies ensure that the residence has at least one cooling room for extreme heat days, and that the cooling room is maintained at a humidex level below 35 degrees Celsius at all times. This concludes training on Part 4, Quality Assurance Measures for Service Agencies that own or operate supported group living residences and intensive support residences.